heard is we actually have more a healthy person, not necessarily spectrum children, but a healthy person who has a good diet, who hasn't been on a lot of antibiotics, has more good bacteria living in their intestine than they actually have cells of their own body.
Wow.
So a healthy person's walking around more foreign than they are self.
Oh my goodness.
Now, that's obviously not necessarily the case, but our immune system doesn't attack the lactobacillus, the acidophilus, bifidophilus. So, but it seems as if for some people that the body doesn't recognize the candida yeast as foreign either. And so our immune systems are just leaving it alone. So we're not fighting it off the way that we're supposed to. And so that's why using antifungal treatments, be it medicinal or herbal, is necessary because the immune system's not doing its job. Now, kids who have been weaned from the breast, like, will use other things like colostrum or IgG products that will kind of flag those cells, those yeast cells, and tell our immune system, hey, here's a guy that's not supposed to be there, attack it. Naturally, our immune systems don't seem to be doing that for some of our patients. So that kind of compounds the problem. But certainly the more ear infections, the more antibiotics that a kid's on, the more likely that they're going to have yeast infections. There's a correlation. It's not 100%. There's certainly kids who have never been on antibiotics that do have yeast, but certainly if I took 100 kids who were on 10 antibiotics in that group and 100 kids who are not, there's going to be a difference when I check those kids. So that's kind of where the problems come. And then of course, you know, when their intestines have been damaged, they're more prone to food allergies. The allergies build up. They end up with another ear infection. They get on antibiotics, and so it's a cycle, that like a vicious cycle, a spiral, but downward that ends up happening here. And so, you know, obviously from a preventive perspective, don't let that get started in the first place. In my practice, I mean, I have one family out of all the primary care families that I take care of who that the kids get ear infections. I mean, I don't see kids with asthma. I don't see kids with diabetes. I mean, I see them who transfer into the practice for me to help them with it. But kids who are born into my practice, who I do preconception work or I do prenatal work with, they're born from the beginning. I mean, I haven't, for that matter, I have not had a single kid in my practice who was born into my practice who developed autism.
Really?
Not a single one.
What do you think you're doing differently?
A lot of things. Yeah. Okay. So, you know, and so I hopefully can get the families preconception. And especially a lot of my spectrum families who, after we've especially made some help, you know, made some good movement in the right direction for the kids, and the families actually feel stable enough to try it again. That's, of course, a very scary thing, as you can imagine. And so a lot of their moms, those moms are like, well, is there anything I can do to help prevent this? So hopefully I get them preconception so I can start cleaning the mom up. You know, whether she has candida herself, you know, does she have mercury? If she has fillings, I want to remove them, but I wouldn't do that when they're pregnant already or when they're lactating. So there's only certain things I would do before getting pregnant. So some things I have to stop. I wouldn't do, or if I found out that they were pregnant, I would stop doing it. So that's one of the things. If there's mercury in the body, of course, cleaning them up, making sure they're on good omegas, but if they're eating fish, making sure that there's no mercury there. Considering doing chelation challenges to see if mercury or lead's there and getting it out. Another thing I'm wanting to look at, especially in the spectrum families, but I are looking for like some of the abnormal methylation, so some of the genes that are involved with properly activating folic acid to folate, the MTHFR gene. If that's there, I'm putting those women straight on folinic acid or methylfolate, not just folic acid, which is in most prenatals, but the activated form, because if you have that gene, you can't activate the folate. And
so
I want them on methyl B12. Well, it's actually, it can even build up and cause other things to slow down even. But more importantly, then it's not there for the fetus to develop. I want them on methyl B12. So, you know, there's that aspect. I want to know everybody's vitamin D level. I want everybody's vitamin D level to be above 50 nanograms per milliliter, which is not what the lab report comes back and says 32 and above is high, but I want them to be 50. I want to make sure that they're getting enough calcium. I want to make sure that they're getting enough, even just like the fiber in fruits and vegetables and fiber and phytonutrients. So those are all part of what we do. If there have been a lot of antibiotics, especially if the mom's had yeast infections herself, I'm trying to clear the candida before they get pregnant. You know, so those are things if I can do beforehand. Other one of those things that I'll do during pregnancy is more on giving them as much nutrition, but I'm not really putting a pregnant woman on like fluconazole during the pregnancy. I mean, if it was very late in the pregnancy, I would do that because we can give a premature baby it intravenously. So, of course, I wouldn't have a problem giving a 35-week mom it if she got a yeast infection because, again, we could give it intravenously to that baby if the baby was out. But I wouldn't want to necessarily do that with a 5-week-old fetus. You know, we don't really know about that.
We don't know.
We don't know. There's just too much we don't know. But that's part. So that's what we're doing. And then even, a big part of it, and one of my areas of what I actually consider myself most knowledgeable about is not autism. what I actually consider myself most knowledgeable in is in breastfeeding and lactation medicine, and how to properly establish a latch and how to properly get the flow going and how to avoid or treat all the engorgement and those types of issues, which there's positionings and things that you can do. You could prevent all of that, or you can treat it virtually instantaneously. And again, I want that woman breastfeeding hopefully long term, because that's going to help.
How long
You know,
would you recommend?
Well, I mean, even the Academy of Pediatrics now says a year. So they can, so and longer if mom and baby are willing. So I'd say the average in my practice is probably 18 to 24 months. We know that if a woman breastfeeds for more than 2 years in her life, she reduces her overall chance of breast cancer by 50%.
Really?
50% reduction in breast cancer for breastfeeding. And if a woman breastfeeds 6 years combined in her life, it reduces the chances of premenopausal breast cancer to under 1%.
Oh my goodness.
So that's reason enough. Let alone we know higher IQs in the babies, less diabetes, less asthma in those babies. We know that the women, they lose their weight, the weight faster. That they themselves, there's a lot of benefits to the woman as well. So
you're definitely a supporter of leche.
Oh, yeah, definitely. And I do lecture even for La Leche League for their annual conference when they come. I've done that for the last 5 years. So that to me is a very big part of it, because I just truly feel that if a baby could be breastfed during that first year of life, that a lot of medical problems could probably be avoided.
Absolutely.
Yeah.
And I think that's what Mother Nature or God or whatever your,
Yeah.
I guess, belief is.
Right.
That's really how our bodies, I think, were meant to take care of us, right?
I always ask myself the question, what does every other mammal do?
Mm-hmm.
And that's a good starting point. Okay, they don't birth in hospitals, and God only knows what they don't induce pregnancies and have C-sections. I mean, granted, there may be a time for that, but we all know that how incredibly high the C-section rate is, and babies born in hospitals are exposed to germs that wouldn't. So, not that every baby should be born at home. In fact, I don't really advocate for home birth, but I do work with a lot of midwives and birthing centers. But or if the baby's born in the hospital, get them out as soon as humanly possible. Don't spend the extra night because they give you a free dinner. You get out of the hospital and get home, get into your situation. I want the baby.
Is it because of the lack of germs, or?
Well, no. Well, I mean, there's germs like Candida is actually, and Clostridia are higher in hospitals than they are in your house. Yeah, they're called opportunistic infections, and so these are infections that are more present because there's people who are more immunodeficient in hospitals. People in hospitals have been on a lot of antibiotics, so there's just more things that are around there. Even like the MRSA, the MRSA bacteria, they're much more prevalent in hospitals. So, hospitals are great for sick people if you're sick, but babies aren't sick usually, and so so I want them to be home as soon as possible.
Well, as you're talking, I'm thinking, oh my gosh, I had a C-section. It was an emergency C-section. I was in the hospital for 6 days because I had a kidney infection. I was only able to breastfeed for 10 days because I was so sick. And I'm thinking, oh my gosh, why didn't I know him back then?
And again, and the point of this is obviously not to make people feel bad because they didn't. I realize people inherently do what they want, what they think is best, but exactly, it's about information because most women aren't given the information that they need to make educated decisions. And whether you're talking about vaccines or antibiotics or educating your kid or whatever, informed consent means that you're not just consenting to something, but you've informed yourself, you're educated yourself as to what your options are so you can make a proper decision.
Yeah.
Unfortunately, that's something that is completely lacking in most people's decision-making process. They're being told what to do. They haven't thought twice about it. What the doctor said to do it, so I'll do it, and that's kind of where most Americans' mentality is because they never stop to think about the fact that, hey, I'm an intelligent person, and I have instincts for my child that other people aren't going to have. And when I find that when families actually tap into that, which is a question, I mean, that's something that I ask family every single visit, like, well, what do you think about this? What's we can go this way, we can go this way. What's your instincts tell you? I find that usually a mom has the right instincts and will, if given the choice, will actually make the right decision probably better than the doctor will.
Well, for all you viewers out there, you guys now got the information that I didn't get to get. So I'm very excited for you guys on that. And I can't believe how fast our time went. I could sit here and talk to you forever. You're so fascinating. And I want to make sure if they want to get in a hold of you, can you, or find out more about your work, can you give them your website? I know it's one of those ones you have to spell, you guys.
Yeah,
so.
and actually it's kind of funny because I found out that if you just Google my name, which is kind of weird that I actually come up top now across Google, which is really kind of weird.
Okay, so if you Google
David
David Berger.
David Berger, holistic pediatrician, or David Berger autism, it actually pops up first.
Okay.
But my webpage is Holistic Peds, which is www.wholisticpeds, one word, holisticpeds.com.
Wonderful. And so you guys can find him there. And if you missed the lecture that he gave, please, please, please go to www.nationalautismassociation.org. And I'm sure you guys can get it that way. And definitely check out his website. If you know people that are trying to think about conceiving or they're in that preconception mode.
And on the lecture section of the webpage, I have a lot of the lectures on there. So there's actually a lecture that I gave here 2 years ago called "Prevent Harm Now: How to Conceive, Carry, and Raise a Child in a Toxic World," and it goes into a lot of the very specifics and specific dosings and things that we talk about today.
Oh, see, look at these great resources you guys have. So definitely check that out. And again, thank you so much for taking the time with us.
Absolutely.
And to all of you guys, thank you for allowing us to bring hope into your homes. Until next time. Bye.
Bye-bye.
Thank you for joining us for Autism Approved with Kristen Selby Gonzalez. Please join us next week for another episode brought to you by Enzymedica.